Hello everyone, drberkkkaratas. In our premature ejaculation video series, we will talk about the causes of premature ejaculation, which is in our second video. When talking about the causes of premature ejaculation, we need to talk about it by making a little classification, because there are different types of premature ejaculation. The first type of premature ejaculation, we can call it primary in medicine, that is, premature ejaculation from the very beginning of a person's entire sexual life. When research was done on this, it was concluded that some genetic factors and some receptors were effective in this. Of course, we know that this rate is around 28 to 30%. We generally use some drugs that have already been developed against this serotonin and have been developed to prevent their reuptake. In other words, premature ejaculation may occur due to a genetic passage or a structural condition. However, the majority of premature ejaculation is due to false beliefs made in childhood and adolescence, family pressures, inappropriate sexual relations, especially the first sexual experience. It is because of these, but I think that if we talk about them here, they will be talked about until the morning. Especially the issue of inappropriate masturbation is important to us. Because in our youth or adolescence, we acquire a behavior as a result of masturbations that we do inappropriately, quickly, without pleasure, perhaps several times a day, only with the experience of ejaculation. So, technically, masturbation harms our sexual development as long as it doesn't imitate intercourse, and because we masturbate inappropriately in our adolescence or teenage years, and even now, premature ejaculation develops as a result, which is actually the most common cause of premature ejaculation. The second type is premature ejaculation, which is later, so this is like this. For example, you have been married for 10 years, everything is fine for 9.5 years, you say that I have had premature ejaculation for the last 6 months. Something is wrong here. The condition is either organic, that is, you have a disease, or it is psychological. The most common cause of diseases is inflammation of the prostate, especially between the ages of 20 and 40. Studies show that 75% of patients with prostate inflammation have premature ejaculation. Again, if this is too much related to our goiter gland, there may be premature ejaculation that develops later in the disease we call hyperthyroidism. High testosterone, some psychiatric drugs and erectile dysfunction, which is also very interesting. If a person has erectile dysfunction, I mentioned it in the first video. A person will usually want to end the action quickly from the action that he cannot do, that he cannot achieve. For him, too, there may be premature ejaculation. Or we can understand it like this. Oh, don't let my hardening go away. At least in order not to be disgraced in that regard, the person can also ejaculate prematurely at his own request. These are diseases. There are also psychological reasons. Of course, the most important psychological causes here may be partner problems, spouse incompatibility, fights with the spouse, sexual dysfunctions. At the same time, sexual reluctance can cause premature ejaculation in general. Infertility is this important. I also have many patients in this regard. Forcing men to have intercourse at work during infertility, that is, having a child, can also cause premature ejaculation. Because the idea of doing it at certain times on a certain day may be easier for women because they are more passive, but it is not an easy situation for men, and premature ejaculation is seen in 25% of the diseases treated for infertility. Another form of premature ejaculation is variable premature ejaculation. Here's how I can describe it. In fact, this is not a premature ejaculation disorder. It is a normal condition and should not be treated. Let me give you an example. You haven't seen your spouse in 2 months. You were together for the first time. And at that moment, you in a minute at work. This is a very normal thing. Because you didn't have a regular relationship, your sexual desire was too high and you ejaculated. Or in a special case. So your high school aspirations may be very high that day. You may have been turned on by your partner, then it may take maybe 30 seconds, but these are for the moment, that is, they are momentary. then everything returns to normal. This doesn't need to be treated either. There is also premature ejaculation, depending on the person. This is, of course, interesting. In other words, it is not actually a premature ejaculation. People say that it normally ejaculates within 5 to 6 minutes. Sometimes it's 15 to 20 minutes. But he says I ejaculate in 20 minutes, my wife ejaculates in 30 minutes, I also have premature ejaculation. No, you don't have premature ejaculation. These people don't have premature ejaculation. In general, if you have seriously warned your spouse before intercourse and ejaculates in 30 minutes, it means that your spouse, not you, has a problem with ejaculation, late ejaculation. One of the biggest reasons for this may be psychological and cultural reasons, but here I also attribute it to the porn movie syndrome. Because, you know, in porn movies, people go on and on for 40 minutes, 50 minutes, but let's not forget that this is a movie. It is stopped from time to time, the shooting is stopped, continued, sometimes men ejaculate, then in the 3rd or 5th minute, then they get hard again and continue from where they left off. Things in movies aren't real. That's why I ask you not to get hung up on them. In our next video, we will continue with drug treatment for premature ejaculation. Thank you.